ACETAMINOPHEN DEXTROMETHORPHAN PHENYLEPHRINE. What is ACETAMINOPHEN DEXTROMETHORPHAN PHENYLEPHRINE used for and how does it work? ACETAMINOPHEN DEXTROMETHORPHAN PHENYLEPHRINE is an over-the-counter, OTC, product used for symptomatic relief of cough and congestion. ACETAMINOPHEN DEXTROMETHORPHAN PHENYLEPHRINE is available under the following different brand names: Alka-Seltzer Plus Day Cold, Theraflu Daytime Severe Cold and Cough, Tylenol Cold Multi-Symptom Daytime, Tylenol Cold Head Congestion Daytime, Vicks DayQuil Cold/Flu, Alka-Seltzer Plus Day Severe Cold, Cough, and Flu, Alka-Seltzer Plus Day Sinus Congestion, Allergy, and Cough, and Alka-Seltzer Plus Severe Sinus Congestion and Cough. Dosages of ACETAMINOPHEN DEXTROMETHORPHAN PHENYLEPHRINE. Dosage forms and strengths. Caplet 325 mg/10 mg/5 mg. Rapid release gel cap 325 mg/10 mg/5 mg. Capsule 325 mg/10 mg/5 mg. Oral solution 80 mg/2.5 mg/1.25 mg/1 ml. Oral suspension 160 mg/5 mg/2.5 mg/5 ml. Liquid 325 mg/10 mg/5 mg/15 ml. Powder for solution 650 mg/20 mg/10 mg/packet. Syrup 325 mg/10 mg/5 mg/15 ml. Dosage considerations should be given as follows. Symptomatic relief of cough and congestion. Adults and children over 12 years. 1 packet orally every 4 hours, not to exceed 6 doses day. 2 caplets/capsules orally every 4 hours, not to exceed 12 caplets/capsules day. 30 ml liquid/syrup orally every 4 hours, not to exceed 6 doses, 12 tablespoons, day. 2 gel caps every 4 hours, not to exceed 12 gel caps day. Children 6 to 12 years old. Oral suspension, 10 ml orally every 4 hours, not to exceed 50 ml day. Oral solution, 4 ml orally every 4 hours as needed, not to exceed 24 ml day. Children 4 to 6 years, 36 to 47 pounds. Oral suspension, 5 ml orally every 4 hours, not to exceed 25 ml day. Oral solution, 2 ml orally every 4 hours as needed, not to exceed 12 ml day. Children under 4 years old. Not recommended. What are side effects associated with using ACETAMINOPHEN DEXTROMETHORPHAN PHENYLEPHRINE? Common side effects of ACETAMINOPHEN DEXTROMETHORPHAN PHENYLEPHRINE include high blood pressure, hypertension, fast heart rate, severe peripheral and visceral vasoconstriction, dizziness, drowsiness, excitability, headache, restlessness, tremors, gastrointestinal disturbances, anemia, blood disorders, neutropenia, pancytopenia, leukopenia. Bilirubin and alkaline phosphatase may increase. This document does not contain all possible side effects and others may occur. Check with your physician for additional information about side effects. What other drugs interact with ACETAMINOPHEN DEXTROMETHORPHAN PHENYLEPHRINE? Severe interactions of ACETAMINOPHEN DEXTROMETHORPHAN PHENYLEPHRINE include ibenguane I-123, isocarboxazid, linezolid, phenelzine, procarbazine, rasagiline, selegiline transdermal, sulfonamide, selegiline, tranylcypromine. ACETAMINOPHEN DEXTROMETHORPHAN PHENYLEPHRINE has serious interactions with at least 44 different drugs. ACETAMINOPHEN DEXTROMETHORPHAN PHENYLEPHRINE has moderate interactions with at least 232 different drugs. ACETAMINOPHEN DEXTROMETHORPHAN PHENYLEPHRINE has mild interactions with at least 81 different drugs. Barbiturates, carbamazepine, hydantoins, isoniazid, and rifampin may increase the hepatotoxic potential of acetaminophen and may decrease the analgesic effects of acetaminophen. Cholestyramine may decrease acetaminophen absorption. Quinidine may inhibit the metabolism of dextromethorphan, increasing its toxicity. Adjust dose. Concurrent use of dextromethorphan with monoamine oxidase inhibitors, MAOIs, may cause hyperpyrexia, abnormal muscle movement, hypotension, coma, and death. Avoid use for 2 weeks after stopping the MAO inhibitor. Co-administration of dextromethorphan with sibutramine may cause serotonin syndrome. Concomitant use not recommended. Guanethidine may increase pressor response of direct-acting vasopressors, like phenylephrine, possibly resulting in severe hypertension. What are warnings and precautions for acetaminophen dextromethorphan phenylephrine? Warnings. This medication contains acetaminophen dextromethorphan phenylephrine. Do not take Alka-Seltzer plus day cold, Theraflu daytime severe cold, and cough, Tylenol cold multi-symptom daytime, Tylenol cold head congestion daytime, Vicks DayQuil cold/flu, Alka-Seltzer plus day severe cold, cough, and flu, Alka-Seltzer plus day sinus congestion, allergy, and cough, or Alka-Seltzer plus severe sinus congestion and cough if you are allergic to acetaminophen dextromethorphan phenylephrine or any ingredients contained in this drug. Contraindications. Documented hypersensitivity to the drugs. Within 14 days of monoamine oxidase inhibitor, MAOI, therapy, known G6PD deficiency. Cautions. Caution in elderly patients, hyperthyroidism, myocardial disease, bradycardia, partial heart block or severe arteriosclerosis when administering phenylephrine, and hypovolemia. Phenylephrine use is not a substitute for replacement of blood, fluids and electrolytes, and plasma. Promptly restore with loss, dilute for and administer via large vein, extravasation precautions required. Acetaminophen hepatotoxicity possible in chronic alcoholics following various dose levels. Severe or recurrent pain or high or continued fever may indicate a serious illness. Contained in many over-the-counter, OTC, products and combined use with these products may result in toxicity due to cumulative doses exceeding recommended maximum dose. Do not take dextromethorphan for persistent or chronic cough associated with smoking, asthma, or emphysema, or if it is accompanied by excessive phlegm unless directed by a healthcare provider. Dextromethorphan may slow the breathing. Acetaminophen, risk for rare, but serious skin reactions that can be fatal. These reactions include Stevens-Johnson syndrome, SJS, toxic epidermal necrolysis, TEN, and acute generalized xanthomatous pustulosis, AGEP. Symptoms may include skin redness, blisters and rash. Pregnancy and lactation. No information is available regarding use of acetaminophen dextromethorphan phenylephrine during pregnancy or while breastfeeding. Pregnant or breastfeeding patients should seek advice of a health professional before using over-the-counter, OTC, drugs.